Well, hello, and thank you everyone for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, an introduction to acceptance and commitment therapy, part one of a two-part series. My name is Emily Moore, and joining me in moderating today's event is Dr. Benjamin Druss, Director of the Southeast Mental Health Technology Transfer Center. Please note that the work of our center is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And also note that our center and the larger MHTTC network use affirming, respectful, and recovery-oriented language in all activities. A little information about our center. The Southeast Mental Health Technology Transfer Center is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. We encourage you to visit our website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events. A few important notes to review before today's event. This event is being recorded and will be made available on our website for on-demand viewing soon. We encourage you to share your comments throughout the presentation using the chat feature. Please remember to select Chat with all attendees if you would like to share your thoughts with everyone. We have allotted time at the end of our presentation to answer questions. Please submit your question for our presenter using the Q&A feature at the bottom of your screen. Finally, for participants who are interested, a certificate of attendance is available for download upon completion of our evaluation surveys. I'll now turn it over to Dr. Benjamin Druss so that he can introduce today's speaker.
Thanks so much, Emily. Hi, everyone. I'm really pleased today to introduce to you Dr. Rachel Waford. Dr. Waford is a licensed clinical psychologist who practices in the Atlanta area. She primarily serves individuals and families who have recently experienced their first psychotic episodes or first bipolar episodes. She seeks to help individuals and families understand and recover from these experiences, while also finding meaning from those experiences as they progress towards their personal visions for the future. Dr. Waford has developed a number of resources to serve this community, including co-authoring a text entitled The Psychosis Response Guide, How to Help Young People in Psychiatric Crises, as well as a TEDx talk entitled Building a Broader Mental Health Community. Dr. Waford practices acceptance and commitment therapy with all of her clients and finds that this approach offers significant support by empowering individuals to make meaningful changes in their lives. In addition to her private practice, Dr. Waford is an assistant professor in Emory University's School of Medicine and School of Public Health. In her free time, Dr. Waford loves playing with her 10-month-old son and spending time with her husband and dog. She also enjoys cooking, watching live music, and practicing yoga. Welcome, Dr. Waford, and thank you for being here. We're really looking forward to your talk.
Thank you all for the introduction. Let me share my screen. Does everything look okay and I sound okay? Guess you'll just give me a note if not the case. Well, I'm really excited to be here presenting on this topic for everybody today, both as a clinician who practices acceptance and commitment therapy and as a person or uses it for the people that I serve, but also as a practitioner who tries to implement these, the things that we'll be talking about today, sort of in my regular life. I'm really excited to share this with you today. So thank you guys for attending. So I'll be giving an overview today of acceptance and commitment therapy, and hopefully giving, there might be a variety of experiences here with ACT, but either way, I'll be sort of The second half of the presentation today will be giving what I hope are just really accessible and tangible ACT-informed strategies that anybody can take away and use today in whatever way that you are serving individuals in your community. I will also be coming back and presenting again next week and talking about acceptance and commitment therapy for individuals living with psychosis. So kind of almost as a case example of how do we use this for a specific population. And I think importantly, a population that we may not always think about serving in outpatient therapy. So hopefully you'll be able to attend again next week. So I've already kind of reviewed our goals for today. So just to give an overview of what is acceptance and commitment therapy, or ACT for short. So acceptance and commitment therapy is something that we call a third wave psychotherapy approach. So if we think about the history of psychotherapy, we start with Freud in psychodynamic theories, as people may be familiar with, and we move into a shift where we're focusing a lot on behavior. So folks remember B.F. Skinner and the Skinner box, and really this idea of focusing on changing behaviors. Then we move into that was sort of the first wave. We move into second wave, which is the cognitive processing therapies. We're really focused on thoughts. And that's where CBT really comes into play for folks who are familiar with that, focusing on thoughts, identifying problematic thoughts, even this language around changing thoughts. And now we've sort of introduced a third wave of psychotherapies, and those include therapies like dialectical and behavior therapy, or DBT, ACT, and other mindfulness-based therapies. So it includes a lot more language around acceptance of suffering, acceptance of different experiences, and an influence on present moment awareness. So just to give you a little bit of background on kind of how ACT has come into play. And ACT was really actually kind of born out of CBT and DBT, if we want to think about psychotherapy families in a way. The overarching objective of ACT is something that we call psychological flexibility. And sort of what this means is that if you have a vision of where you'd like to go, or you're working with a client or an individual who has a vision of where they're like to go, are they open to different ways of getting there, as long as they can keep that vision in mind? And the reason that that's important is any one of us often, when we're trying to solve a problem or trying to get somewhere, we often kind of hone in on one particular direction, and then we kind of get fixated on that. Like, this is the way that it's going to happen for me, or this is the way that it's going to happen for this problem is going to be solved. And we really put in a lot of energy and effort into making that work. And sometimes that is precisely where we get stuck, is trying to make that one way work. And no matter how well reasoned or how well thought out or how well planned, sometimes it just doesn't work. So ACT really introduces this idea of, what if there are other ways to get there, other ways to get to where you want to go? And that could be related to goals that someone might have. It could be related to the way they want to experience the world, or the way they want to cope with something. If you're open to different ways of getting there, even if they're a little bit longer, a little bit different, maybe even a little bit bumpier, and you still get to land where you want to land, is that something that you would be open to? And in order to achieve psychological flexibility, we have two main goals that we focus on. The first, and the place that I personally really like to start, is talking to somebody about their values. So values are this idea of, who do you want to be? What do you want to embody? What is the person that you are trying to sort of demonstrate and show the world? What does that look like? And then the second thing, and so once we kind of establish that, we have a sense of, this is where we're trying to go. This is the journey we're trying to be on in this lifetime, or in this life that we have. And then the second part is, as we're on this journey toward this values-guided life of who we want to be and how we want to experience whatever is happening for us, the things that are pleasurable and even the things that aren't so pleasurable, can we learn to relate differently or in more helpful ways to whatever things are happening for us? Our experiences, the internal ones and the external ones. Can we relate to our reactions differently, our thoughts, our emotions, even our reactions to reactions. So can we have different relationships with the stuff that's just happening? And that's a distinction from the stuff that we can control, right? So there's some differences between, here are some things that I can actually control, things that I can actually change. And then there's a whole list, and often much, much longer list of things that we cannot control. And those are the things that typically cause us the most distress, because we get stuck in this wanting to control things that are just out of our control. And so can we relate to those things differently when they show up for us? So if you've ever had any introduction to ACT, then you've probably seen this picture. It's called the hexaflex. And what this really portrays are the 6 different tenets of ACT. And so anytime you're doing any reading, these are some of the terms that you might hear: contact with the present moment, values, committed action, self as context, diffusion, acceptance. I'm not going to spend as much time on each of these 6 individual ones this week, although next week I will be breaking each of these apart with case examples for individuals living with psychosis, to talk a little bit about what does this look like, what does this area of ACT look like, what are some of the ways or challenges that folks who are having a problem in one of these 6 areas, what is the nature of that problem kind of look like, and what are the ACT strategies. But today I'm really going to be talking about these 6 different tenets in sort of 3 different categories. You can kind of break them apart into 3 different categories. So we can think of them like this. We can think of the 2 of them are related to opening up. That's acceptance and diffusion. 2 of them are related to being present in the here and now, and that's acceptance, or the present moment, and self as context. And 2 of them are related to doing what matters. So today we're going to talk about it in that frame, in the ACT context. And each of these 6, or these 3 categories, are in service of that overarching goal of psychological flexibility. Can I be open to a different way of being and a different way of doing things if it means they have a better chance of getting where I'm trying to go? So let's talk a little bit about what these different categories entail. So for example, being present, which again includes present moment awareness, or otherwise known as mindfulness, is another way to say that, and self as context, really encourage that idea or experience of engaging fully in the here and now. And so that means, and that's a distinction between the past, which is something that has already happened and that we can't go back and we can't do anything about it, but we often spend a lot of time in the past questioning, thinking, wondering, maybe trying to learn from, and also in the future, which we also actually can't do anything about, the things that haven't happened yet. Now we can influence the future, but only by what we can do in the present. So staying in the present is really, really important. So what can we do to really spend as much time as possible in this present moment, since that's where all of our power is, and it is the only space truly where we can enact change, is in the here and now, and it's our only way to influence the future that we might like to have, is what we choose now. And so there are a number of strategies that we can help people practice strengthening that muscle of being in the present moment. So lots of mindfulness strategies, well, all mindfulness strategies are about being in the here and now, and truly like using sensory information, using guided imagery, lots of different ways to do that. And that can be really important because the present helps you utilize what's happening in the here and now to guide your decisions and your behavior. And often another place where we can get stuck, or the people that we're serving can get stuck, is using rules from the past to guide our present. So because of what happened before, I'm not going to do something now, or because of what happened before, I'm going to do it in the same way or in a very different way because of that. Or even the future. So the language of anxiety is what if. So sometimes we make decisions in the here and now based on what if. And not to say that those pieces of information can't be helpful, but sometimes we ignore really important information about what's happening right now, especially when we think about things that really excuse me, might be challenging for our clients, like safety or security. So helping people really ground into the present is really important. And another place that's really helpful is also engaging with our thoughts and feelings in the present moment. So what am I experiencing right now that might be trying to guide my behavior? And sometimes that's going to be really useful. We want to be guided by the thoughts that we're having right now or the feelings that we're having right now. And sometimes we don't. Sometimes we might be feeling something really, really strongly or have a thought that's really, really distressing. And we don't want to do the action that might be coming directly from that. So the present moment awareness helps us be aware of, like, this is what's happening for me right now. And if I don't do anything, I'll probably just follow that. But do I have the option to choose something different? Can I feel something in a really extreme way and choose an action that comes from a very different place? But we have to be present and aware to be able to have that choice. The second category that includes acceptance and diffusion is this idea of opening up. So that is the process of being willing to experience whatever is happening. And willingness or acceptance can often be a little bit misunderstood in the sense of we're just settling or we're fine with it. But actually in ACT, you don't have to be fine with anything that you're experiencing, or your clients don't have to be fine. They get to have all the feelings and all the thoughts about anything that's happening and be able to choose or be aware of this idea that, and there's nothing I can do about it. If I could choose to not feel really angry right now, I probably would. But here it is, it showed up without asking permission first. And so what am I willing to do now? Like, what's my next move now that this is already here? The same for thoughts. We spend a lot of time trying to kind of control our thoughts or not have our thoughts be there. And man, if anybody could figure that out, figure out how do we just choose our emotions and choose our thoughts and get rid of the things that we don't want, I'm sure we would all have a lot less suffering. But unfortunately, that's just not how it works. And so that the process of acceptance is not about being okay with what happens, but it's about saying, there's nothing I can do to stop that anyway. So can I instead use my energy in a different way? Can I use my energy to cope effectively? Can I use my energy to respond effectively, to have the kind of reaction that might be more useful? Again, all those thoughts and feelings are present, they're there, and you don't have to be happy about them, but you can choose to say, I'm not going to waste my energy on something that I can't change anyway, which are often thoughts, feelings, for a lot of my clients, hallucinations, delusions. Those are things that showed up without asking permission. And our option is then to choose how to respond. And so that's obviously the acceptance piece of acceptance and commitment therapy. And so it's about, can we make room for these things, not because we like them and we want them to be here, but because we can save the energy that we might otherwise use to change them and actually use it for something that we can do something about. And the do something about is this third category, the do what matters. And that includes values and committed action. You remember me talking about values in the beginning, that idea of like, who do I want to be in this world and what do I want to embody? And committed action are essentially the goals that get you there. So values are kind of like you're going on a road trip and you say, I'm going east. You know, east is not a destination, it's just a direction. And you'll never land there. You just kind of keep going. So examples of values are things like kindness, non-judgment. Those are things that you never hit an endpoint. They're just things that are important to you. You just want to keep practicing them. And goals, or your committed action, are the behaviors that you do along the way that show you like, yeah, I'm going the right direction. I haven't veered off. I haven't stalled. If I'm not sure if I'm going in the right direction, I can choose a behavior right now that gets me right back on track. So whenever we're thinking about psychological flexibility, we're thinking about these different processes and as the pathways for how to really experience more flexibility. And flexibility is an ongoing practice too. Actually, all of ACT is an ongoing process. So there's nothing really in ACT that's sort of a goal that says, I've checked this off and now I've done this thing and I don't have to do it anymore. Instead, it's like figuring out new muscles and just continuing to strengthen them with ongoing practice and ongoing and use of strategies. And like with anything, we know that the more we practice, the more kind of automatic it becomes, which is nice. But this is meant to be sort of an ongoing practice. It's really a new way of engaging with the world, what's happening internally in the internal world and what's happening externally. So you may have already started to notice, depending on what your personal practices or other orientations or theories of service that you provide, you may have started to notice already or wonder about how ACT is different than other things that you may have learned about or that we've all been learned about and practice. And so I think there's some really, at least for me, some things that really stand out and that are different and that are also built into ACT as well as importantly or deliberately different. The first and probably most important stance that ACT takes that I think sets it apart from other therapies is that it is very deliberate and open in the discussion that suffering happens. It's sort of the one thing that everybody experiences, and it is something that is, in some ways, if we think about it, pretty constant. Now, it might waver or change in its intensity or its nature or its frequency, but suffering is something that is pretty persistent, whether it's sitting in traffic or being, caught up in, in your car in construction, for example, all the way to a traumatic loss or disaster or something that happens in someone's life. But suffering is pretty ever present. And so ACT really opens up to this idea that this is something that we're all going to experience. So our goal when as an ACT practitioner, whatever we're practicing ACT, is to be really deliberate in that conversation and say our goal here is not to relieve you of suffering, because it's often right that people might come in and say, I don't want to be anxious anymore. I don't want to be sad. I want these experiences to go away. And of course, as folks who are serving others, we want that for them too. And from the ACT perspective, we find that it's actually more helpful to give someone some different ways of relating to these experiences so that they actually have a toolbox to deal with whatever else is coming next. Because there is going to be something else that contributes to anxiety. There's going to be something else that contributes to sadness. There's going to be something else. So rather than pretending or operating under this idea that we can somehow get rid of these experiences, we come to the approach of this is something that may keep happening for you in different ways, or it is going to keep happening for you in different ways. But what we can do is help you experience suffering differently so that you actually have more space, even when something really hard is happening. You have more space to experience things that feel really meaningful as well. So it actually, again, creates more flexibility for someone. Can you experience something that is incredibly devastating and protect space on a given day in the midst of that devastation to do something really meaningful for yourself or for someone else? And that's a pretty flexible way of thinking and operating in the world, is creating space for both of those things. It's also really important, even when we're first meeting with someone as an ACT practitioner, to sort of say that we really are open to all emotions, and all emotions have a function. So we're really not going to focus on getting rid of any of this. In fact, what we're going to do is help you cope with it more effectively so that when it does show up, it's not having as big of an impact as it is now. And even going even further to talk about the function. What does anxiety do for us? It helps us be aware and prepared. What does sadness do for us? It shows us what's important to us and maybe something that we've lost. So really clarifying that emotions and even sometimes, and even thoughts to an extent, show us really important things about ourselves. So we don't want to get rid of any of that stuff. Anxiety helps us prepare for a presentation. Sadness helps us recognize when we need some nurturing. So we take that idea of opening up to suffering even a step further to say that whatever you experience, it has a purpose. So we want to figure out, whenever you're experiencing something, what can you take from that? What can you use that would be, how can we make this how can we make something meaningful out of what you're experiencing? Something else that I think is really important about ACT is it's a very formal, non-judgmental approach. And I would argue that all therapies have a non-judgmental approach, and all clinicians would identify themselves as a non-judgmental clinician. I think that's sort of the nature of when you are serving individuals in this way. And ACT takes that non-judgmental approach a step further by not identifying anything as good or bad, right or wrong, or even true or untrue. So there are no good and bad emotions. There are no positive and negative emotions. There are no truths or falsehoods about someone or something. There is truly a curiosity about what someone is experiencing. And there is a helpful and unhelpful option. And helpful is very uniquely characterized by an individual. Helpful in the sense of, is this what you're experiencing? If you allow this to direct your next move, will this help you get closer to that values guided vision that we identified in the beginning? Or is it going to pull you in an unhelpful direction? So we really take this non-judgmental approach. We take it full on, and all the way to the extent of the way that the language that we use and seeing value in any experience that comes up and trying to make meaning out of it. Because if we clarify things as good or bad or right or wrong, then we kind of, that sort of takes us away, I think, from the overall vision of where we're trying to go. And so that might be a distinction that folks might notice from, like, say, CBT, for example, where there is some language like negative automatic thoughts, for example. Very helpful idea in terms of identifying, and that's something that you will find in ACT 2. What are some of these thoughts or experiences deep down that you get stuck on? And when we have sort of something as good or bad or right or wrong, we sometimes can end up taking on that judgment on ourselves. And so in ACT, we really want to free ourselves up from that. And instead, we want to see anything that happens as like, I wonder where that's coming up for me. Interesting. Can I use it? Or do I need to use it? Or can I notice that it happened and decide that's not going to be part of my day today and kind of move along? Now, it might come along in your pocket. You might notice that it's always there, or a client might notice that it's always there. But being in your pocket is different than being the guidebook that tells you where you're going to go today. So those are two different ways of experiencing it. And the non-judgmental approach is really important for that. The other part that I think sets ACT apart is it's very experiential. It is very active. So there's a lot of role play. There's a lot of use of metaphors. There's even activities that are really akin to exposure therapy, like we see if you're serving folks who are living with anxiety and you practice exposure and response prevention. That is very similar to ACT. So with this acceptance of what we experience, and with this willingness and this willing to open up to what we're experiencing, like we practice that in sessions, both in session, and there's a lot of active practice outside of session to not just talk about relating to things differently, but let's relate to them differently and see how it goes, and do a lot of observation about how that feels and what showed up, and with a lot of coping as well. How are you going to cope with what you're noticing, what you're choosing to experience? How can you take care of yourself along the way as well? And the last part that I think really sticks out for me when I'm practicing is this intentional recognition of what we can control and what we can't, and a willingness to surrender in a way, and to let go of trying to control the things that we just can't control. Not because we don't want to, not because I don't want to control a lot more things in my life, but because no matter how hard I try, I just can't seem to get there. And so can I let go of that need to, or that willing, or that desire to, but do something else with that energy instead? Can I do something else with that energy that is meaningful for me, that I can control? And I might always have a feeling about, or an experience about wanting to control that other thing. That might never go away. But while I'm still having that experience of wanting to control thing A, I'm over here doing thing B that is helping me engage in my life in a way that feels meaningful. So again, it's about how can I be flexible in my life, or how can we help our clients be flexible in their lives on the journey toward what it is that they want. And so can they relate to their, engage with their experiences differently, whatever their symptoms are, whatever their circumstances are, in a way that allows them to feel like they're moving towards something that's meaningful to them. And that's going to look different for people. People are obviously going to have different resources and access and their ability to do that. They're going to have different constraints with whatever their demands and responsibilities are. And so the work of ACT is also figuring out what are those, if we're building this journey brick by brick toward that person's, in the way that they want to experience their life, like what are the bricks for that person? What is that one thing that that person can do today with their situation exactly how it is, not how they want it to be, but with exactly how it is, with whatever resources they have and with whatever feelings they have about their situation. What is something that they can do that would feel meaningful and tied to whatever it is that they might want? So I wanted to share just a couple resources of how that I use to help people to both understand some of these places where people get stuck and to help move toward that values guided experience. So this is something that's called Dissecting the Problem. So ACT has a lot of worksheets and activities, and a lot of these are actually free. I'll share some resources with you at the end where places that you can get a lot of these resources that you can just like download and use. And then also some other places where if you decide you want to get a little bit more deeper into ACT, you can have some access to some additional resources. But this is again called the Dissecting the Problem worksheet. And what it asks people to do first off is to kind of condense what it is they're experiencing into kind of the main problem. Like, where is the main place that you get stuck? And not because there aren't many different layers of the problem, or there aren't histories and context to consider, but to really distill it down into something that feels like something you can really chew on or work on together. And then the very next question is, what does this stop you from doing? So before we ever talk about values or purposely work on values, we're already having a values conversation. What does this problem stop you from doing in your life that you want to be doing? And that will start that conversation of, okay, well, family is really important, or connection is really important for this person because their problem is impacting their ability to spend time with their loved ones. Or productivity and accomplishment is really important. Education is really important, or learning, let's say, if we're thinking in values terms. So it already starts to give information about what is important for someone, and that the problem is really creating a barrier in their connection with that. And something that we know about values is that the bigger the gap between what someone wants for themselves and what they want to experience and what they're actually doing, the more distress someone experiences. So if you really want to be connecting more in your life, or you have a client that wants to be connecting more and all their energy is put into doing something that is not in service of connection, there's going to be distress there. That gap is going to be really big. So there are lots of different values exercises that can be used to help people clarify, well, what matters to me and where am I spending my time and how are those things different? Because values, there might be some that are really obvious to us, but if you, what I hope is when, and I'll be happy to share some resources that you can go take a look at around this, but I would encourage everyone to do your own values exercise if you haven't already. It's pretty challenging to sort of narrow down what matters. And so I'll get to that in the next slide though, but I would encourage everybody to do that. It helps you kind of understand that process that can be really challenging. So what is the main problem? What does it stop them from doing? And what is maintaining the problem? So in this activity, they identify 4 different things that actually keep the problem, that sort of, again, maintain the problem. One is thoughts. So what are the thoughts that come up? Thoughts, memories, whatever that kind of content that you get kind of tangled up with that keep the problem going. What are the feelings that come up around this problem that you kind of get stuck on or that you're trying to avoid? What are the avoiding behaviors that you're doing that might maintain the problem? So examples might, things that people do all kinds of things to avoid. So they might be sleeping, let's say, for example, or not going certain places or not being around certain people. And that might continue to maintain the problem. And then what are the things that you are doing that are maintaining the problem, that are making it worse, for example? And some of those might be a couple things. So let's say, a lot of folks use to avoid situations, and then that also creates more stress and can be a life-draining activity as well. So this is a way to start a conversation with someone about and really kind of hone in on these different components, since these are the components that you'll really be working on someone with if you're practicing ACT. And some of that history and that context will come up as you explore some of those things further, maybe in later sessions. So when we're thinking about values, like I said, there are lots of different activities to help someone further clarify those values. If you start with maybe that activity that we did before, or even if you just start a conversation with values when you're meeting someone for the first time. So the one to your left is called the bullseye. And so this is a free, something that's free and available that really helps people identify, where do I want to be and where am I in my journey toward that. So they kind of ask people to sort of identify where they are. They sort of, this worksheet asks people to identify some very specific values in those 4 areas, and then kind of place themselves. Where am I on my journey toward that? The one on the right is another values exercise, different, and I use different ones for different clients based on kind of what feels like might be most helpful as I'm learning how they think about things. And so this is sort of another way to ask people to identify 3 values that they are really important to them. And so this is another way to help people kind of hone in on what's most important, so they can help think about that life that they're envisioning for themselves. So as we, just kind of giving an overview of ACT, and again, everybody here today might have different experiences with using ACT, all the way from this is the first time you're hearing about it to someone who maybe is someone who practices this on a regular basis. But what I thought I would do is for each of these areas, just give some examples of some prompts or questions that you might be able to use that are very ACT consistent, ACT focused, and might help you start to practice some of these things in some different ways. And some of this may look similar to what you're already doing. So you might recognize like, oh, I am doing some ACT consistent strategies in my practice. And then some of these might feel new to you. So if you're wanting to really kind of help someone explore their values, some prompts that you might use, whether it's a larger question, like the second question, well, what is it that you want to stand for in your life? When you think about your legacy, and sort of a values guided question, for example, what do you want to have stood for in your life? Or a more specific question around a specific problem that someone may come in with, like an argument or an issue at work or something like that, is to ask someone, well, what kind of person do you want to be on the other side of this? If you could kind of look ahead, how do you want to feel or about yourself on the other side of this problem? Or what kind of person do you want to be on the other side of this problem? When we imagine that it's now resolved, how do you imagine you'd like to feel in terms of how you handled it? What actions you took, what things you wanted to do but didn't, what temptations were sort of pulling you, things you wanted to say but you opted not to. So those are some values guided questions that help people think about viewing themselves in a different way, bigger than just I'm going to react to what I'm experiencing, but more about I'm feeling this pull to react to what I'm experiencing, and is that the person I want to be? And could I choose something different if I can notice that option? And that noticing the option is an example of that flexibility that we're striving for. Committed action is essentially goal setting, and it's goals that are guided by values. So for example, if I have a value of kindness, what is an action I can take that allows me to feel like I'm being a kind person? What can I do today to embody kindness? What is an action I can take? And so some questions that you might, or prompts that you might share with someone might be, once you're having, and values and committed action are it's hard to talk about one and not talk about the other, because one is about what do you want to experience, and then the very next question is going to be, well, what can I do to get there? So you might ask someone, well, what are you willing to do to be that person? So let's, if we go back to the slide before, how do you want to be on the other side of this problem? Okay, well, what are the actions that help you get there? What are the moves you need to make to be in that position of embodying that person that you would like to be on the other side of this problem? What do those moves look like? What are the specific actions that would lead you in that direction? Another very early strategy that I might use with someone we're talking about values is, what is something you could do today after our meeting that would help you feel like you are embodying one of the values that we talked about? And that's also a really easy and early accomplishment. So someone might be coming in with this big, overwhelming, seemingly formidable problem, and very quickly be able to achieve a really important goal. Well, you told me you wanted to be this person, and here you are today, after our early sessions, taking a step to being that person. And so early accomplishments, ACT is all about early accomplishments as well, to build that motivation and that confidence and that momentum. So in that practice of acceptance, some of the prompts or questions that I like to use or that might come up are helping people clarify, what are the things that we can change here? And what are the things that just are? Because sometimes we can get caught up in that. We can get caught up in I really wish this hadn't happened. And then it's already happened, and there's nothing we can do about that. So actually helping to clarify, like, okay, here's my list of things that I can change. Here's my list of things that I can't. So how can I put my energy into the things that I can affect some change, so that I can feel some meaning in my life? I can feel some accomplishment. I'm also going to cope with the things that I can't change that are really important, but can I help clarify that so I know much more where my energy is going? And then also really inviting people to, what are the things that you might have to experience to get from point A to point B? What are some of the things that might show up along the way that we can go ahead and be ready for, so that you don't get caught up and you don't get stuck? What are some of the things that are just part of the nature of recovery, or part of this journey toward healing, or part of this argument with your spouse or partner? What are some of those things that we can sort of open up to, that you're going to experience, that you might typically catch you or hook you, that we can sort of be prepared for? Emotions, thoughts, reactions from the other person that we then react to that get us off track. So it's sort of being ready for and opening up to the different things, so that we can continue to stay focused on that journey, and we're not getting distracted by the things that really want to suck our energy, but we can't do anything about them. Diffusion. So you'll notice I am actually mentioning the 6 parts of the hexaflex as we go. Next week, I'll be giving a lot more specific examples about strategies for these. But today is just kind of an overview of what are some of the strategies within that. I kind of forgot that I do give the tenets at the top. I know I said I was just going to stick with the 3 today, but you're getting a little bit of an intro to all 6 tenets today, but we'll be much more specific about strategies next week. So diffusion is that idea of getting away of, it's part of that opening up sort of, category. And it's idea of separating ourselves from our thoughts, that our thoughts aren't facts and they aren't truths. They're sort of just content that we can notice is there. We can open up to, like, wow, look at all the things in my mind today. And then we can decide if we want to use them or not. So we can help people be aware of what are some of the things on their mind, because oftentimes, our mind just populates with all kinds of thoughts, and often it's really helpful. We get around pretty well by doing what our mind tells us to do. Just so happens it doesn't do a great job with emotions and stressful situations, emotions though primarily. So we really want to be aware of, in areas where we're really being challenged, if our mind is guiding us in a direction towards something that may not be helpful for us. So asking people to be aware of the kind of thoughts that they're having, asking them to think about, is that thought in line with who you'd like to be or what you'd like to do? And if not, can you notice that thought is an option, and choose to maybe go a different direction? And And just also helping people not get caught up in the, if my mind is telling me it's so, then it must be so. If I'm having the thought that I'm a bad person, then that's just it for me. Helping people really again, be flexible in how they use the stuff that comes up in their minds. Self as context, that was that other, the other piece of present moment awareness. So the top was the mindfulness practice, the being in the here and now. Self as context is this idea of separating ourselves from our experiences. So it might be the difference between I am depressed versus I am a person who experiences depression. Those can feel very different to someone. And there are lots of ways to help someone access that experience, or something we would call the observing self. So if this were happening to someone else, what would you advise? Or if you could be like standing up on a mountain looking down at your problem, is there something else that we're not seeing here that might be helpful that we could use? Or another way, if we could look at your life 6 months from now, what would you like to see? So it's helping people get sort of take a step outside of the problem, so that they're getting a break from that filter that we often have, or that our clients often have when they're going through something challenging, and see the world from a different viewpoint, and see if that offers something different. Because when we're experiencing something, our client's experiencing something, it can create a filter, and we see everything from that lens, or see many things from that lens. So self as context is that process of taking a different perspective or a different position to see if we get access to anything else from a different position, essentially. So in the process of ACT, we just kind of went through truly an overview of ACT and what it is, and what sort of the fundamentals or the tenets are of ACT, and how it's what sets it apart from other therapies, and even what are some hopefully tangible things that anybody could take today and use in their very next meeting or appointment or session with someone, to start providing a different way of relating to what someone might be experiencing. And so there are lots of resources if you want to know more. I'm an ACT practitioner, but I'm not an ACT expert. And in fact, ACT is unique in that you actually can't become certified in ACT, because the idea is that everybody is a student and a learner, and you're always practicing, that none of these tenets you can be like, I'm never going to reach a place of like, and I'm done with acceptance. I'm at the maximum capacity of acceptance. So the idea is that it is important that as a practitioner or a service provider, practicing that in our own lives in order to serve other people with this. And so, but there are people who serve people with this approach. But there are people who do a lot of this practice and write a lot about this practice, and you can be certified as a trainer in ACT. So a lot of these texts are by people who are certified as trainers. But again, there is no certification in I am an ACT therapist, because it's meant to be I practice ACT in different ways. These are some of my favorite texts, both for their accessibility, for how easy they are to just read and kind of go through, for their resources. So I wanted to share those with you. The Association for Contextual and Behavioral Science, or ACBS, is at the bottom there. That is an international network of people who practice ACT, and it is, you can join based on whatever fee you would like to pay. They have some suggested fees, but it's really meant to be accessible for all. And once you are a member, you get access to all kinds of resources. It's just an incredible resource. So I wanted to share that with you. I get a lot of resources and connections there. And so now I just wanted to kind of pause and allow some space for questions, if anybody has questions, and I'll certainly do my best to share them. And then knowing that next week, if you're able to come back, we'll dive even a little bit deeper by focusing on a particular experience that folks have. So psychosis, for example, and how we might apply these principles for folks with that experience. So with that, I will end my presentation and open it up for questions for the next few minutes.
Awesome. Thank you so much, Dr. Wofford. I am going to go ahead and just read some of the questions that we already have from people in the chat, if there are any. And then again, everyone, if you do have questions that you'd like to submit to Dr. Wofford at this time, go ahead and drop those questions in the Q&A feature that is at the bottom of the screen. So I'll just give everyone a little bit of time as I search the chat to see if there's any questions that we have already.
Okay.
There is a question that we have that's in the chat from while you were speaking, and it is, can you please differentiate between ACT and the hope psychology triangle of goal direction, agency, and pathways?
Oh, I'm not familiar with that model. Goal direction, agency, and pathways. I'm not familiar with that model, but just hearing the language, it sounds like there's probably a lot of similarities. I mean, goal direction sounds a lot like values and committed action. Agency is certainly something that we're striving for individuals through ACT. I mean, the idea that helping you channel your energy toward the things that you can do something about so you can have a lot more agency in your life, and helping people relieve themselves from being focused on things that they actually can't do much about, which really can reduce a lot of feelings of agency. So it's ACT is very empowering when people are practicing it. And then, well, and I guess I would say pathways sound a lot like values. So I certainly, my guess would be that there's a lot of overlap, but I'm not familiar with that myself, but I'll have to look into it. I think you said it's called the HOPE model. Yeah, I'll look into it. I don't know. Thank you for sharing.
Yes, thank you. Our next question that's just been put into the Q&A feature is, among the books that you recommended, is there any book that comes with some good worksheets that can be used in session?
Yeah, great question. So I actually don't have it on here, which is wild because it's my very favorite text. It's called ACT Made Simple, and it is the easiest text to read. I use it constantly. I wonder if I have it on my bookshelf, but and it has a lot of resources. So for and most of these texts have these, but that one in particular, with every chapter that has resources in there. And Russ Harris, who is the author of that text, you'll see his name on here. He's written several texts. He also has a website where most of his resources are free, downloadable. So you just go to his website and he'll have like the dissecting the problem, the bullseyes on there. Most things from his books are there. And he also has a Facebook page where people can like share questions and stuff like that. So he is, so ACT Made Simple, I would say would be first and foremost. Get Out of Your Mind and Into Your Life is a really helpful one too. That was like actually my intro into ACT. And it's meant to be it's sort of a self-help book. Like it's meant that someone could go pick it up and use that for themselves. But I like a lot of the resources in there too, a lot of the exercises that it asks people to practice. So that might be another good one too. It's going to have a lot of resources embedded in there since it's meant for, it's written for consumers. So.
Okay, thank you. Our next question, what is one way to support a client's progress towards values without participating if they weaponize their own values against themselves, like to berate or judge themselves?
Oh, that's a good question. That's a really good question. And I think how I've seen that show up is I always whenever I have someone do a values exercise, it's usually, one of the things I've shown you, or there's a values checklist, which is another great one, is I then ask them to explain to me why it's important. So tell me why this is important to you. Of all the things you could have chosen, because all the activities ask people to share like a certain amount, even though there's a lot of options, is ask them to tell me why that's important to them. And then I might ask them, and then on a scale of 1 to 5, if 1 being this is very important to you, but no energy is going there, and 5 being this is very important to you, and I spend a lot of time trying to embody this, where would you land? And these are all just very curious questions. And sometimes that conversation can help clarify for people, So if they say, well, it's very important to me, but I don't put any energy there, well, that's a natural conversation as to, well, how would you like this to look different then, for example, or what would you like to do different to bring this into your life? And then sometimes people choose values and they give, there's a lot of great conversation around those. And then over time you realize, like, wait a minute, there seems to be a disconnect between what you say you want and what you're doing. So sometimes it might come up naturally. And that's part of our job, is being able to reflect. So this is something that you've continued to say that you want, and it's been really hard to actually embody that, or it's been really hard to complete those goals. I wonder if it'd be helpful to go back and rethink that, because sometimes we can get stuck on values. All of us can get influenced by the things that we think are the right thing to say, or what someone would want us to say. And sometimes we embody values that really are not the values that we have. So some of that can come up naturally in some of those early questions I just shared. And then some of it can come up over time as the practice of trying to embody that value really becomes a struggle. Then it maybe is realizing that it's actually not the right fit, and there might be something else that's more important. I hope that's helpful. Helpful response to that.
Yes, thank you. We have time for one more question. And that final question is going to be, how would you apply ACT with individuals dealing with serious, persistent mental illness or intellectual or developmental disability simultaneously?
Well, my first answer will be, if you can attend next week, that would be great. Since I'll be, that will be a part of the case example for next week, is using ACT for individuals living with psychosis or psychotic-like symptoms or schizophrenia spectrum disorders. And so first, if you're able to attend there. Secondly, I think there's a long answer to that question, but the short answer is ACT is very applicable to both of those contexts. And so for symptoms of psychosis, we would treat those just the way we treat like other thoughts and emotions, as sort of what are with the content, what's useful, how can we use this in a way that's more meaningful? What about this doesn't align with how you think about yourself? And so can we help you cope with what's happening and choose how you'd like to respond when these things happen? Some of these things can be a little bit more challenging with intellectual disabilities, like some of the metaphors, for example, but it certainly can be really flexible. There's flexibility in ACT with what you choose based on someone's capabilities. But if you're not able to attend next week, there are lots of resources on like ACT for psychosis, for example. And so, that you might be able to look up that can give you much more detail than just my very, very short answer.
All right. Thank you so much, Dr. Waford. That is all of the time that we have allotted today for questions. Thank you everyone for submitting your questions, and please make sure you're able to join us next week, same day, Tuesday, same time, for part 2 of this series. We'll go ahead and move into the evaluation portion of today's event. We at the Southeast MHTTC value your feedback and invite you to evaluate our webinar today. Please complete a brief SAMHSA required survey by visiting the link presented on your screen. Completion of this survey will provide information to SAMHSA and assist us in planning future events. Afterwards, you will be automatically redirected to additional questions from the Southeast MHTTC regarding the impact of this event on your knowledge and skills. There you'll have the opportunity to download a certificate of attendance for your records. Please allow about 5 to 10 seconds for your browser to redirect you. Again, our center would like to thank you for your participation and feedback. Dr. Waford, we'd like to thank you for this amazing presentation, and we look forward to seeing you again next week. Thank you, everyone. That's going to conclude today's webinar event.
Thanks, everybody. Thanks for having me.
Thank you.